So we're here with Dr. Gilll Rickard, veterinarian and competitive dressage rider, and we're here to ask her thoughts on the training of the young horse.
The training of the young horse is a long and complex process, and the success of the training that leads to ultimate success is guided very much by the beginning time with the horse. So my main piece of advice would be to regard the physical and mental health of the young horse as strongly as you can. So by its physical health, we all think we know about nutrition, we think we know about rugging the horse, how much work to give the horse, and that's great. But to be more specific, you need to think about the equipment that goes on the horse and how it's going to affect the horse. And for all of us, nearly all of us ride with a bridle, and that's one of the first pieces of equipment that goes on a young horse. So the bit and the fit of the bridle are particularly important. I think then if you want to go another step further with the bit, you want to know what's happening in its mouth. And young horses have a lot of activity going on in their mouth. They're losing teeth, gaining teeth, shedding teeth. They've got sharp points, they get ulcers, all sorts of things can be happening, and you may not even know they're going on, and you're asking the horse to respond to the bit in a friendly way. So I would recommend that the horse's teeth are looked at by a equine dental vet before the first bitting, and then at least every 6 months after that, because there are so many changes occurring. Riders are inclined to think horses are being difficult quite often when they don't do things right, and particularly with the bridle. Often they're being difficult simply because they've got pain, and that pain has come from a sharp point or an ulcer or an erupting tooth. And it just sets up a habit with that horse that will lead to long-term problems that will affect your results later on. No one likes a horse that grinds its teeth. No one likes tongues hanging out or open jaws. And nearly all of those problems come from bad early training. And the early training, which is affected so much by whether its teeth have been attended to properly or not. So from the beginning with your young horse, my advice is do it right from the beginning. Have the horse looked at by an equine dental vet before you first start to ride it and bit it, and then continue to do that throughout its working life, but especially while it's a young horse. Don't assume when it's being difficult that it's just being difficult. Please assume that it's got some pain. And then you'll be glad later on when your horse moves up the grades, jumps higher, gallops cross country, chases a cow, that it responds to the bridle well. And it'll do that if you do the beginning part right. I'm Dr. Gilll Rickard, and horses have been my passion for a very long time, and I wish you all the best with yours.